have a small outpatient program and do a good chunk of IOP. I guess I can just jump into the cases. I guess before I do that, it's probably clear. The main thing is, I'm basically in a role where I am, quote unquote, the child psychiatrist, or really, frankly, sometimes called just the prescriber, because we have some nurse practitioners and whatnot, where I am, not supposed to carry therapy patients. But I think this happens to a lot of us when we're in those roles. We join with the family, we make a connection with the kid, and the kid is like, I don't want to do therapy, yet they'll come in and talk to you, and you kind of become this de facto therapist. So I've always kind of, with short 30-minute appointments, I've kind of jimmy rigged, sometimes put such cases, right before lunch, or at the end of the day, or I have some type of break to take the extra time if needed. But a lot of times I just have 30 minutes, which also makes it kind of challenging. So the two cases we could go in depth about. I mean,
I was thinking, Anthony, if
yeah,
you want to give like just a quick one line on each, and then maybe the group could sort of
yeah,
pick which to start. Does that sound good? Okay.
yeah, that sounds good. So the first one is this is a family that I have now treated 4 out of the 5 kids. There's 5 kids in the family. Um, there's 2 older biological, now adult kids. Actually, the one that I've never treated or met is actually getting married. She's a young, I think, 20-year-old. The eldest son I've treated. And then this family adopted 3 kids that are semi-related. 2 of them have the same biological parents, and the other one has the same biological mother as the bottom 3. I don't know if I'm describing this well. The
So
current
that's like
patient,
2 full siblings and 1 half sibling?
yeah, yeah.
Okay.
And then they were adopted by, the same family.
Mhm.
Um, they do have some half siblings that were adopted by another family that they kind of know about, but it's not a big part of their life. The current patient I'll talk about, and I currently treat all 3 of these siblings, the younger ones. The current patient I'll talk about is the youngest in the family, a 13-year-old cisgender female. And basically, she had done therapy before, doesn't want to go see a therapist, doesn't really want to engage. She was seeing another child psychiatrist in our practice who kind of described her as, just kind of the kid that would just sit there and chill, not really engage much. He ended up leaving Kaiser, and so they ended up coming into my practice. And I've seen her almost for a year now. I think May would be a year. And recently, mom kind of said, hey, she really does talk with you. She doesn't want to engage with another therapist again, doesn't want to do family therapy, but there's been this long tension between her and parents. A lot of defiance issues. And specifically, mom asked, hey, could you help improve the parent-child relationship, specifically between dad and this, my patient? And that was just actually the past couple of weeks. And we had kind of our first session with that goal, actually this week. The other family, it's a family of 2 kids. The oldest one is out of the house, I think the second year in college. I actually was treating her and ended up treating the youngest one, a sibling. Started treating him in 5th grade. He's now in 10th grade. Pretty high functioning kid. Does have a touch of ADHD a little bit, but what has come up from family wise is he's pretty self-critical, and can be a little bit, I don't want to say horribly disorganized, but kind of also laid back about things. I think dad can be a little bit laid back. Mom is much more structure, thrives off having everything kind of finalized, much like older sister who has autism. And there's just been a lot of, they actually, even though they like to just kind of come in and talk to me pretty frequently. And the main issue is he's pretty self-critical, and then the tension between he and mom and et cetera.
Thank you, Anthony. Nail it. Anthony was just laying out two different cases, and I know you had a case as well, but I'm wondering if we can pick maybe one of Anthony's and then maybe have time for yours as well. Does that sound good? Okay, so case number 1 or case number 2, they both sound super compelling to me. Who votes case number 1? We dive in.
I vote 1.
Charlotte votes 1. We have 1 vote for 1, 2 votes for 1. How many votes for number 2? We've got 1 for 2. All right, case number 1 it is.
Okay. All right. So, so this last kind of session I had, I had both parents there and her. And really in that session, I kind of just focused on trying to just kind of, even though I've been working with them almost a year, and this has been an issue ever since they kind of came in, and I've tried to kind of always kind of talk about relationships and help them. This was really the first session where they, this is what we're going to talk about. We're not going to talk about the Prozac or other med I've got her on, type thing. So I just wanted to lay the groundwork on what they, kind of join with each person and hear from them what their own perception of the issues kind of coming. I appreciate feedback on this, and I kind of I kind of said, who wants to go first on this? I kind of told them that's what I was going to do. Nobody really jumped at it. Dad kind of indicated. So I started with dad, and maybe it was just because dad was sitting I was sitting, they were kind of sitting in a circle, an arc, and I just started with dad, moved to mom.
So it was the two, both parents and the patient?
Yeah.
And Anthony, just because I know in the beginning you acknowledged your challenge that sometimes you have like an hour time, sometimes you have half an hour. What was the context of this session?
So this one I had arranged for them to be at the end of the day for me. But we got started a little bit late. And basically mom kind of said, yeah, we need to, basically we had 30 minutes because they needed to leave at some point.
So it's, wow, okay, 30 minutes. Wow, pressure.
Yeah. So I,
Complex bridging in 30 minutes.
Well, I didn't, yeah, that's the thing. That's what I was like, I'm just going to join with them, and I didn't really try to bridge.
Yeah.
So what kind of came out was, in a message mom had written to me with this ask, really focused on dad. And historically, that has been the issue. In fact, I was looking at my notes. The initial time I met with them, they talked about how, even though she can be defiant with mom, really much more defiant with dad. And so it was interesting starting with him just to hear his view. And he said, yeah, but he really kind of laid it out almost as if this is an issue that's with both parents, which mom said yes to. And basically they're, dealing with just kind of, in a way, typical defiant stuff of, she doesn't want to, move from preferred activity to a less preferred activity. Now, sometimes this in the past has escalated to her throwing things, her being super aggressive, kicking. The past psychiatrist had started antipsychotics because of this. I've gotten her off of that. And basically I have an SSRI and a stimulant, which has been helpful.
You don't have to get into detail, but what's your kind of working diagnosis of the kid?
She has a touch of ADHD and anxiety.
Yeah.
And a little bit of trauma, because the first patient, the oldest of these adopted 3 is really immature, developmentally delayed, and really impulsive and aggressive, had, chased other members of the family with a baseball bat. There were times I would get, so this family actually has my cell phone, and I would get, a staff message or internal staff messages from the ER, like consecutively
How
on
recently
week.
was that going on?
That was probably about 2 years ago. I've thankfully gotten that patient doing a lot better.
Got
They're
it, but not that
doing
long
some-
ago. Yeah.
No, not that long. So this is a family that has had a lot of services, maybe not necessarily because of this patient, but
Yep.
they've got ABA, they've had, crisis services like an ICTS service, intensive and home stuff. Yet nobody was really doing a lot of parent-child
Mhm.
stuff. Like, and my
How-
view of,
Oh,
yeah, yeah.
go ahead. I was just gonna ask, just quickly, you don't have to get into detail. When were the kids adopted? Like,
So the youngest one was adopted at 2 days old.
okay.
I believe the other kids were adopted relatively young too. And
So this teenager and her older sibling were adopted at least in early childhood?
yes, yeah,
Okay, got it. Okay.
yeah, yeah,
Okay.
yeah. So there's her, then there's a brother she has. It's about a year and a half older than her, and then there's a older, about 2 year older, also sister. That's the one that's really impulsive. Um,
Oh, so
and yeah,
she's the youngest then?
yeah. She's the youngest out of the 5 kids.
Oh, so
And
she was the one who was adopted at 2 days old.
yes,
Okay,
yes,
sorry. Okay, got it.
yeah, yeah.
Okay.
Sorry. And from working with them, over the various patients or, kids that I've seen in this family, and doing like kind of just chain analysis of them, like, okay, let's talk about when the stuff really hits the fan, so to speak, slowing it down. I think these are really loving parents. They really love these kids, and they're trying their best. I think we just, myself and just the system needs to support them better, because dad, you know, I identified one of the kids like really like this bunny, and that would help soothe her. And so I was thinking, let's talk about how we can, if you start to see the volcano start to explode, intervene quickly to get the bunny there. And dad said, he raised his hand and goes, I have an issue with that. And I thought he was going to say, the kid's going to be too aggressive and kill the bunny. He goes, no, he didn't say that. He just goes, and this is about a teenager. He goes, well, if she's being naughty, should she get this, reward of petting the bunny? And I was like, oh God, he doesn't even see that this is about just soothing her down.
Mhm.
And there's been times where, if one of the kids yells, dad is quick to yell back. Nothing that, CPS, I felt CPS needed to be called about, but just, he'll add fuel to the fire. And so he kind of presented that, he just wishes that she would, listen better and maybe not be so explosive. Mom kind of confirmed that and said, yeah.
Anthony, can I
And
check something
yeah,
with you? Is that okay?
yeah,
Because I know you're so used to dealing with these extremely complicated situations, right? In these small amounts of time and having to like triage it. But
yeah,
I'm wondering if it may be helpful for everybody to step back just for a moment and sort of talk about kind of what are the main frames that we can think about in this case, because there's multiple
yeah, thank you.
layers. Does that make
Yeah,
sense?
yeah,
So
yeah,
one thing, I'll just say something quickly and then other people can add, but one of the things I always think about in our work is sort of a 3-level thing at minimum, right? Top level is like, what's the illness? What's the diagnosis? What are all the psychological challenges, right? And what's the treatment plan for that? What does everybody need to understand that and work together on it, right? We're all used to that one. The second layer is like when there's been chronic strain and stress, what's all the collateral damage that's piled up over the years? Does that make sense? That's getting a little farther out. And
right,
then another level, this is way oversimplifying, but it's more like the root issues. Does that make sense? That can be hard
right,
to talk about if you're still in crisis mode. Does that make sense? it strikes me by the way you're talking about the case and the amazing work you've done with everybody, that they're just at the point of shifting with this kid to getting a little bit out of crisis mode and more into, okay, let's look at a little bit bigger picture. Does that make sense? From
Yeah.
there, you've already acknowledged there's at least 3 major like frames going on, right? One is just her becoming an adolescent, just normative adolescent stuff, which is obviously different in this particular context, right? Given her developmental challenges, her history, and all of the family understanding that. 2 is her identity as being adopted and their identity as being an adoptive family, right? And the things that come up for teenagers. And 3 is more the trauma history, including what may be unprocessed about a lot of the trauma the family has had over the years with all the kids.
Yeah.
Does that seem reasonable?
Could I complicate it just a little bit further?
Yeah. I want other people to add. Yeah.
The dimension of the nature of the relationship. So we use sort of this acronym, is that what it's called? Curate, caring, understanding, respect, acceptance, trust, and empathy, if you get all of those. And the question is like, what is the nature of the relationship? Not their behaviors with each other, but how do they show their caring to each other and acceptance? And that's particularly, Michelle, I think relevant for the adolescents, because that's such a challenging time where parents are often understanding them as 9-year-olds when they are, 15. And that's also where you have money in the bank, like, how do they connect? Each of the dyads, how do they connect? And in this case, how does dad and this young lady, how do they connect when things are going well? And what is their money in the bank? So the relationship piece, aside from the behaviors, I think is a dimension that I think is useful to think about and explore.
And that's such a good point, Betsy. And part of what I am with thinking about these big picture things, we can't obviously deal with all of that in this session.
No.
But what I'm trying to do is I'm always trying to be aware, what's this big field we're entering, knowing this is a big deal for them to start this conversation, and then trying to be mindful of what are the frames I can use to like normalize it and give some buffering.
Yeah, I like that a lot. And that's why you wouldn't try to understand the whole curate thing, but some aspect of the relationship that looking at the positive to get them hooked in would be one way to think about it, I think.
Yeah.
I also wonder about the relationship between the siblings, or if there's a waxing and waning where if the older ones are maybe more stabilized, the younger one has, their moment now to get the attention. Is there a sense of what the sibling dynamics are?
Yeah, you all want me to comment on everything that people have been adding at this point, or?
Yeah, go ahead. Yeah, whatever you think is most relevant to what you want to get to, and keep going.
Well, I didn't know if anybody else wanted to jump in.
Yeah.
I also had one quick question, which is that does dad really want her to listen more, or does he want her to obey more?
Yeah, obey.
Okay.
Yeah, good point.
Just one other quick thing related to how the adoption themes and the adolescent trajectory may be impacted because it's so common. We don't know, but it's possible that the older children these parents raised may have had a very different developmental path. So that this could be feeling very different to these parents in a way that's kind of challenging.
Yeah, well, definitely they're kind of the middle kid that's developmentally delayed has had a different trajectory and is on a different path. The other 2 are kind of similar. I mean, the oldest son had depression, anxiety, et cetera. And that's actually how I first met the family. Like, God, that was probably 7, 8 years ago.
I mean, their oldest biological child of
Yeah.
these. Okay, got it.
Yeah. And actually, I ended up treating these 3 younger ones because honestly, a cute little story. I was up at our local elementary school with my son, who was about 6 at the time. And up comes this adolescent on a bike with the bunny. I was trying to, being dad, like it was time to leave. And I had to take a deep breath because my son's like, oh, I really want to pet the bunny. And I'm like, oh, we really need to get home. Okay, fine. and, starts having this really nice engagement with this adolescent. And then the mom shows up and then says a thing that's, sent anxiety in my own self goes, "Hey, you're a doctor, aren't you?" And I'm like, "Oh my God, I can't remember her name at all." And she recognized me, and basically this really impulsive one was in an RTC, and she said, "Could you take over care when we get out of that?" And after that, I've kind of just brought on the other two. Anyway, the so the dad plays a role of kind of the protector in a way, in that, again, one of the siblings can be very aggressive. In fact, they all can at times. And, he's had to do some restraints at times, kind of keep everybody safe. But on the other hand, also he can be the enforcer. And there have been times, talking about the just sibling dynamics, where this younger one, the youngest one, and the other kind of impulsive sister have really butted heads a lot, and their rooms are close to each other. They'd yell and scream and get into it a lot. Yet the youngest one would often come to the sister's defense if dad stepped in. She felt like her sister's getting attacked and being harmed. The youngest, so the 13-year-old actually feels most close with the oldest daughter that's getting married, and safe to go talk to her about stuff. And she actually is living at the house currently, even though she's a young adult. And then the adopted brother, they kind of have an okay relationship. He kind of has an okay relationship with everybody. Everybody kind of had, there's a lot of trauma, as you can imagine. And, I think everybody is walking on eggshells on when the next person might go off. So we had a discussion over just how does family meals go, because that is actually one of the more tense kind of moments, because it's where they're trying to get everybody to come, and often, somebody is not going to come because of just the trauma. And that's what it sounds like to me. They're too anxious that, somebody's going to have, get too aggressive, or, just yell at the table, and they don't want to be part of that.
Wow.
Um,
You're painting a really great picture, so intense. And one of the things that it sounds like is going on is the youngest of the three adoptive kids is developmentally outpacing now the middle of the three adoptive kids. Does that make sense?
yeah, the developmental, yeah,
That even though she's the
yeah.
youngest, that
Oh,
she's
yeah,
functioning developmentally,
yeah,
which can be
yeah,
hard for her as like, I'm the little sister, but I have to step up and all that.
yeah,
There's many things
yeah,
going on.
yeah, yeah. Yeah, that's a whole other dynamic we haven't even explored I haven't even explored with them about
But you
that.
can see how important all of this context you have is for when you're zeroing in on these three people who are here,
Right,
right?
right, right. And maybe some of the parents really haven't talked about. I mean, either one of these kids would be, you know, take a lot of energy. And so I could see where, this family is kind of just depleted. But the mom, who's a stay-at-home mom, and actually has been the teacher for most of these kids, they actually were homeschooled until recently. So her relationship, she is a lot more closer to pretty much all of the kids, because of that. And then, so, the kids tend to maybe come to her a little bit more, see her as more of the person to go talk to about emotions and stuff, but they're still, um, she doesn't obey mom all the time either. But she's maybe less aggressive, with mom for sure.
So all this being said, I want to let you keep going the way you want,
Yeah.
Anthony, I'm wondering if you can share, knowing all of this, it's so much in this session, you have half an hour. I think it's interesting to talk about how we prioritize what we're even trying to do. And then we can talk about the process of doing it. And I'd be interested to hear what other people would say too.
Yeah.
And you
So,
started talking about joining. This was a start of this conversation.
right.
Join with everybody.
Yeah. And so I was, wanted to hear everybody, the issues, what they, wanted out of this, what getting better looked like for them. And one thing that did come up, and I was able to maybe join them all around, was everybody acknowledged that there wasn't a lot of positive time. Particularly, there was actually no regular positive time between my patient and dad, but they both wanted it, and mom definitely wanted it. And so I was able to say, okay, that's one area of agreement that I can see. And so I prescribed, let's set up one-on-one time, even if it's just a special 10 minutes every day, or, just once a week or something. But, and then, instructed them, don't talk about anything else, just play checkers or chess, whatever. And y'all can maybe comment on this. So I said, it's important to let the kid kind of decide, what to do and let them lead. And it was interesting. This is where patient kind of spoke up and said, I don't want to pick. And I was like, look, you don't have to pick. I was really more telling your parents, like, if you wanted to play checkers, or if you wanted to break the rules in checkers, let you, do that, and stuff like that. And everybody kind of understood that. And so that's one thing for us to follow up on. And then another thing that came up was, so I, at the end of the session, just also wanted to check in. How did this go for everybody? Everybody thought it was nice, good. Dad said, he interestingly goes, I wanted to hear more from my daughter and more about like the why. And I think his question was, why do you not like me? Why are you so mad at me? And, I want you to explain yourself.
Being curious and not defensive.
Yeah.
And dad.
Yeah.
You did a
Yeah.
good job creating that space that he could do that he felt connected with, that you got his pain so he could give his kid space. That's amazing.
Yeah. Yeah. I appreciate you saying that, because honestly, I was worried this was going to be more like, that it was going to be like, I don't understand why you're not doing what you're, why you're treating me like this. And then I'm hoping he can, I guess, hear whatever the reason is, and
Yeah,
change
that's
in a
the
nice
work.
way,
Yeah.
versus like, well, that doesn't, oh, that's not a good reason. You should have,
Well, and
obeyed me.
people, and you can clarify, but people may say exactly what you said. Oh, I want to understand more from my daughter. They can say that in ways that convey defensiveness and anger. And they can say that in ways that open conversation. I was assuming it was at least in the middle.
Yeah, and actually the way it was more feedback to me. He was like, I want to just have you, I want to hear more from her about the why part. And yeah, I guess it's helpful to hear that actually it could be a positive thing. And I shouldn't
And
be.
that's where what we do to punctuate or bridge can magnify it, including the clarity. Like if he says that, right, then to say to the kid, wow, are you surprised to hear your dad has all these questions and wants to understand more?
Mm,
Because
yeah,
that's like making sure everyone's getting it. He's offering, he's trying to open a door. Kid, are you wanting to open it too? Oh, cool, you want to open it too. Or like when she said, I don't want to pick, right? I would want to understand more what she meant by that, but also say, like, oh, wow, cool. You want your dad to come up with something that you think you might want to enjoy?
right, right.
You see what I mean? So you're grabbing the positive to try.
Yeah,
And sometimes when we do that, we learn it's more negative than we think. We got to deal with that. But often it just helps get a little momentum going and frame it.
right,
Right. So like, hey,
right.
oh, there's a lot more to talk about here. Part of what's going on between you guys, you don't even have time to talk to understand each other. Is that right?
Yeah. Oh,
Oh,
yeah.
okay. Well, that would make it
Yeah.
hard to get along.
Yeah. Yeah, and I like how actually, Michelle, how you frame that too, where I think in session, I just kind of solved that issue for them in a way, where
Yes.
you more threw it out as a question, like, okay, well, if you're not going to do it, what about dad doing it? And they could have discussed that, whether I just kind of stepped in
Right.
and solved that, which is kind of like, no, I need to move this family towards solving their own problems.
And you're helping with process. And again, there could be
Yeah.
both positive and negative reasons. The kid may be intimidated by dad. She may be afraid to suggest something. She may think she'll be dismissed, or she could just genuinely want his attention to be like, I'm going to do this special thing with you. I'm going to teach you how to change a tire, whatever it is.
Right.
So there's always like multiple sides going on, and we don't always know until we go. Usually there's some positive and negative, and we want to help people see the positive when they can't.
Okay.
Because I
Okay.
think this may be a good moment to talk about negative attribution bias. Do you guys know what that is?
Mhm.
In relationships, where basically, part of what you've described is an environment where there's been so much stress going on. They haven't had a lot of positive interactions in a long time. And for any relationship, we know that you need positive and negative to buffer, right? So what that means with the attribution bias is if this kid makes a comment or whatever, says something wise, dad's going to automatically go to a much more negative place than maybe the reality.
Right.
And the
Right.
same for her with him. They don't give each other the benefit of the doubt.
Mm-hmm.
And what you're creating is space to get beyond that. So but we have to be very sensitive in these cases where families have lost the positive buffer, that like it's really hard for them to even talk about the weather.
Yeah. So do you think, Michelle, because it's funny as you say that, I was like, well, gee, I had a negative attribution bias toward dad on his comment on that.
Oh,
Right.
interesting. What would you say about that?
Well, it was more like I was like, oh, okay, now he's gonna try to pull out, the reason why she's acting this way, and then poo-poo that as not a valid reason was my concern.
And
And
maybe he would have done that, maybe not.
oh, right, right. But then if I had to handle it like what you had said, and I kind of just left it there of like, okay, we'll do this next time. And I think that's how I'll start is like, just kind of, you framed it in a positive way on what
Yes.
that comment was. So basically you helped the family kind of see this could be positive and have a more positive attribution to whatever is said instead of, just going negative and assuming it might be negative.
Because
That
they're
makes
going to
sense.
always be focused on the negative right
Yeah.
now.
Yeah.
So they need a lot of help. And it's not surprising to me to hear that you might have had that bias with dad because you've heard so much more from the kid.
Yeah.
That's the perspective you have. So it's going to weigh your reactions.
I
Yeah.
wonder if it might not be more manageable and where you could intervene and guide were you to have them do something fun in the next session. Let's pick that up where we left off. Let's do it now. And maybe have some choices of kinds of fun games or fun
Oh,
things.
yeah.
And just let them do it. And
I'll
have that.
often, yeah, I'll often say that, especially with the dads and teenage girls, that's a hard divide. And I'll often normalize that. And what they'll often say is, oh yeah, when I was little, we used to do this. There's no way I'm going to do that now.
We
But
use
to say to a dad, like, oh, yeah, hey, what would you like to do with your daughter?
Yeah.
We use build a card house. We have a deck of cards, and if they can't come up with anything, we say, well, here's something that can generate a lot of laughs, and this is a challenge. See if the two of you can build a house of cards together. I mean, that can go either way. They can start blaming each other, and that's not necessarily good, but something, light and fun that they
Yeah.
would enjoy. And then you just drag that out for 30 minutes, and you have an intervention there.
Yeah,
That's
make
good.
some balloon animals or something where it's
Yeah.
not a competition, right? But it's fun.
Yeah, yeah.
I have to say, I'm kind of laughing along because our oldest turns 13 this summer. So,
Not easy.
and, so I'm like, yeah, dads and teenage daughters. I'm going to have two
Yeah,
of them.
with little kids, you can say like, okay, let's play Barbies or something. Let's,
You may have to
look at-
go out to Claire's at the mall and look at earrings for a while.
Yeah. 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 So, yeah. So how we set it up, after they're like this, hey, this is working for us. I was like, let's grab as many appointments as we can.
Mhm.
So I have 3 appointments scheduled. The furthest one out is going to be with all 3 of them again, and it's kind of later in the day. We'll probably have an hour for that. The other ones are going to be 30 minutes, and I kind of set it up where maybe I'll just meet with mom for one session, and if dad can join, great, but he's probably going to be at work. And then I'm going to meet with the patient again with mom, And then we'll have this one where
And
everybody's,
I'm so glad you're saying that, right? Because we can, given all these layers, there's so much to do and unpack. But I want to ask you to comment a little bit on how you message the family about it. Because I think that's really key as we're going, right? How are we deciding who's coming when? And what's the bridging even across those sessions, if that makes sense?
yeah, yeah.
Because I think those are really important decisions. I'm totally with you, but we have to collaborate with the family on it and be clear about what we're doing. And who's ever not in the room for different meetings, sort of decide, well, what, if anything, do they need to know and how to bridge it?
Yeah, and so that, it kind of just happened like that of, that's just how my schedule and their schedule kind of worked out.
Yep.
I only have, I have very limited outpatient time. And so
Yeah.
I have a little bit of hours on Tuesday afternoon and then Wednesday morning. And so it just happened, okay, dad can only make this late appointment. So and then I had two others that were sooner. And honestly, it's not, should probably follow up with them. It's not clear the next appointment if it's going to be with kid or just mom. There is some that it's going to be in the morning, and there was some discussion between them two if it was too early or she wanted to go to school or not. I kind of said, okay, it's fine either way.
That's a great example, because sometimes that happens and then we literally don't know who's coming till they come. But here's what I would say as a process point. Given you just had that family session, you still may want to start that session with the two of them together and then sort of check with them. Say, hey, I want to have a little time with kid today. I want to have a little time with you guys together. What order should we go? I want to make sure I get to check in about what we talk. You know what I mean? Like, so whatever's thrown at us, we can still contain that process and get their input.
Yeah, and most of the time I've met with her and mom because the kid.
Yeah.
In fact, I had one session where the kid just kind of came in, and I didn't think much of it. But mom was actually shocked. She's like, she never sees a therapist alone.
Yes.
And
That sounds surprising because often we have to start with talking to them with their parents, right?
Yeah.
But that's wonderful because I think as you go and get deeper with this family, like you're going to want to have some time to just talk to this kid about her adoptive identity before like maybe you get into all that with, like, as an example, right? Or the sibling stuff,
Right.
her perspective.
Right.
So that's wonderful. You're sort of on that road.
Yeah. And I think I want, it'd be interesting to, focus on some of the positives and have a session when I'm just with the kid alone, about what are some of the positive things about dad or, and see what she can come up with.
Has anyone had the experience of sometimes feeling frustrated because whoever is showing up is not the group you want? Do you know what I'm saying? Like, it's like, oh, I want everybody, or I want to, but can I tell you what helps me with that frustration? Is once I know this big picture, like, with this family, I can work on it with whoever I have. Give me anybody. And I can keep working on the same issues. But I just have to be mindful of how I'm bridging. So I'm like, cool. Okay, grandma's here today. Great. Does that make sense? I don't mean to make it sound simple, but when you have the whole perspective, you can be very productive with anybody there.
Yeah. I mean, what I'm hearing you say is you kind of have a lot of balls in the air, and it's kind of like, there's probably some order to it, but really it's like, okay, this is the ball I've got right now. I'm going to work on this.
And with an eye towards
with
the system.
with all the system, and you can always talk about people that are not in the room and stuff like that. Yeah.
And always remember to say to the kid when you have that opportunity, what, if anything, that we're talking about today would you like to be able to talk to your parents about? Right? Give them the options. We want to have them have some privacy and have help with bridging the things they want. Does that make sense?
Yeah.
And the balls are all interconnected. That's the metaphor. And then, Michelle, I wonder if you would say something about how it might be useful to think about beliefs in this family, given that they're, it's adoptive kids, and how that might play into this challenge.
Yeah, and I think the adoptive experience for all of them is just one example. Like even just beliefs about that are hugely important. One of the frames that I have found very helpful in what we know about adoption and how people emotionally experience it is always talking about the adoption triad. What that means is the person who's adopted, whoever they're adopted into, and also the biologic parents. Like that's always present. even if the biologic parents are dead or whatever, right? And so
Mm.
from there, people often have very different beliefs and experiences, right? We know it's normal that a kid this age is going to be experiencing it very differently, thinking about it differently, asking different questions, maybe starting to think about finding biofamily.
Yeah.
So there's a lot to just normalize, but always being open to, like, what I always say to people is, what should I know about what your adoptive identity is like? Like, what should I know about your experience of adoption and how you look at it?
Yeah.
It's kind of like
Yeah.
the same thing with blended families, that there's not one right way. There's so many different ways to look at it, but it's important that people are able to express it. And very commonly, I understand why families don't talk about it. So it's very common, just like in blended families or any families, where people aren't thinking about, oh, here's how I see my role with you, right? Like a step parent, for example.
Yeah.
Right. Or in this case, like, some adoptive children look at it like they're all my full siblings. Right.
Yeah.
Other people look at it like, oh, I have more connection to my biologic brother. I'm fully related, whatever. Like, but it helps families to talk about it.
Yeah. And they are, there's not too much tension around that, but there is some joking. Because they're all, these three adopted are actually all biologically related. They're half sibs and two are full sibs actually. And there is a little joking around like, oh, we got the better dad or something sometimes.
Well, that gets to do, there's also
That
always with
does-
any adoptive thing, there's always the insider outsider dynamic stuff
Yeah, well, and what's
in
also
all
interesting is,
directions.
so
Yeah.
the one that's developmental delayed, it was getting so intense and been hospitalized. And the family has been told by other providers, like, this kid is not going to get better. You really need to move her to a group home. And this has been like discussed, I think, at the family level. So you talk about like, yeah, you're adopted. We love you. But, and the family does not want to do that. And they've kept her in the home. We've been able to do that. But, of her actually being removed and being put in a group home.
Well,
And
that gets to a whole other set of like belief questions. There's a couple other layers to it. One would be like even how they talk about that as a family. What the 13-year-old understands about that, what she should understand about it, what she believes, how they talk, right? And then
yeah,
there's all their beliefs around what being a teenager means.
Yeah.
yeah,
What
Yeah.
does being 13 mean? What does that mean you now have freedom to do or not? How, right?
yeah.
How, like, there's a lot of different beliefs we need to know about that.
Yeah. And then his family is also very religious. They're Christian. And that's actually been a good support for them. All the kids go to some type of like Bible study and
As part of their identity as a
yeah.
family.
Yeah. And the mom has made comments that God has given them this, one of the opportunity of having these kids, but I think she didn't somewhat kind of framed it in, this, they're they know it's been a challenge, but they've been tasked with this by God, and they wouldn't have been if they can't be up to the challenge type thing. It's big source of strength for I think everybody in the family.
But when you're getting into those beliefs about like the teenage stuff, for example, like one thing I'll often do is I'll joke, they've already survived 3 other teenagers, right? And
Yeah.
I'll say, how good a teenager are you, kid? You just turned 13. When did you start acting like a teenager? How good are you better at it than your brother? Right? Like that normalized, like everyone's different. It brings up a lot of stuff.
Yeah, yeah, I like that. Okay.
So lots of beliefs to explore. Again, with all the
Yeah,
different levels, how the trauma has affected them all. That's a whole other thing.
yeah,
Right?
yeah,
What these parents, if I had these parents alone, I would want to understand from them their sense about this child's adoptive identity, their sense about where this kid is relative to most 13-year-olds, how she
yeah,
treats her siblings, what they think is psychologically affecting her the most.
yeah, yeah. And there's definitely um this thing where they have this high set point now of normalization of what, because they, yeah, they're not necessarily in crisis anymore, but there's still a lot of conflict. It's just that one of them isn't going to the ER,
Yeah.
it's been, for the last few months, nobody's gone to the ER, and that's
Well,
great.
And that's one of the most encouraging things of everything you're saying, that now that they have this moment of opportunity, they're committed to coming in and doing the work. Because that's
Yeah.
the time you can actually get some of this other work done.
Yeah.
Right. So
Yeah.
that, I think that's a wonderful sign of your relationship with them and of their understanding, right?
Yeah.
That they have
Yeah.
plenty to work on, which is awesome.
Okay. Yeah. Yeah. I
Can
think I've got,
everyone else relate to this? Any other comments? And we can certainly jump into another case. I think that'll be great, but.
No, this is really helpful to hear because the case I was going to present, with the blended family as well, and just, um, no, anyway, I just took a lot of notes that I find pretty useful to think about. And I'm curious your thoughts about bridging across sessions with my case when I met with parents separately, and so how you do that.
Oh, cool. That sounds compelling.
yeah,
Yeah.
do you want to just bring your case up and we transition? Because I
Is
think
that all right?
I'd love to hear this too, and why not? Let's use your case to talk about that.
Sounds great. Well, I appreciate the time and support. So I've been seeing a family for family therapy specifically, and am on session 12 with them this week. They had seen a previous nurse practitioner who did family therapy with them, but she was also at one point the med prescriber for the identified patient, who's a 21-year-old male with high functioning autism, but still severely impaired by his not just autism but DMDD and anger outbursts and rage. He also has ADHD, and you know um, and I don't think he has like any personality disorders that have been diagnosed, but he certainly has this like cluster B feel to him. So family returned wanting some family therapy specifically to move from a place of hopelessness to hope. This blended family that comes in is the Asher, who's 21, his dad, his stepmom, Natalia, who's from Russia and who brings her son, Platon, who's a teenager now. He's 16. There is another brother who's actually attended 2 of our sessions. He was there yesterday with us, and he's younger than Asher, but is developmentally kind of more ahead in that he's off to college and he's not in the house, but he comes back for breaks. And I don't know what brother's diagnoses are, but he talks about depression, anxiety, and interestingly, I mean, he has a lot of rage too. But so, the first ask has been, how do we find hope in a context where the 2 parents and Platon, this young man who actually, when I first started working with them in September, was severely depressed and suicidal, although we didn't talk about that explicitly. I just know from the treatment team. How do we move to hope when it feels like we're being held hostage by the 21-year-old who constantly rages and attacks with his words? And I think when he was younger, it would get physical, or he would leave the room and pace, and but now he can actually, he's doing his own individual therapy. He's making progress in lots of strides, but they feel trapped. And the trapped dynamics are, some of it is that Asher is so dependent on his dad for everything. There was a period of time where he left the home, lived in an apartment independently. And I actually don't know exactly why he moved back, but they do describe that there was some peacefulness with that space. But he leans on his dad. He's incredibly jealous that his dad has another partner and that his dad has a relationship with someone else. So
What's the time frame of that, Nayla? When did the blend?
4 years.
Oh, it wasn't that long ago. Okay.
Not that long ago. So,
Okay.
we've done some work, talking about blended families and, grieving what was lost, but also what's gained. But I think one of the interesting things is Asher had so much, he's so lonely. He wants social connections so badly. And he says he has friends. But he, puts people off so much because of how rude he is and how loud and intrusive, and he doesn't respect boundaries and all this stuff. So he desperately wants the stepbrother Platon to be his friend, and Platon wants nothing to do actually with the whole family. Platon's own issues that he's talked about briefly in session, but it's been a lot of pulling him out of his shell and making the space comfortable enough, is that he feels like his mom betrayed him when getting married, because, I don't know really enough about their history, but I think it was just the two of them for a long time. And I think they went through a lot of stress together and immigrated here to get married. But he feels like he was like the adult, he was a parentified adult figure to mom, and now mom's found someone else. And so he feels incredibly betrayed. They speak Russian, and that's their primary tongue. And I think in the past they would sometimes like have their own conversation, which doesn't happen quite so much. So I guess just to focus a little bit, in some, there's been a lot of different things. I had some hope that we were making progress, in the sense that I've seen all of them be able to be somewhat vulnerable with each other. We've gotten beneath the anger and the rage to get to shame and sadness, but it's really hard. I guess where I ended yesterday was just naming, especially for Asher, but actually for a lot of them, including the brother. It's hard to be respectful when you feel attacked, and it's hard. And there's so much rage still in the family. So yesterday's session, the brother was home from break, and he had been with us one other time where he came and he basically just like raged at his brother the whole time and said, I hate him. I wish he was dead. He's holding everyone hostage. And go ahead.
How was brother raised at Asher, you mean?
Yeah.
Okay.
And so yesterday's session, when he came in, I wanted to play a more active role, partly because I had a parent-only session the week before, which I think Asher was really mad about, that he wasn't included. But parents are saying, we're feeling a bit hopeless because he's regressed recently. He's more clingy to dad. He's more lashing out at the stepmom. And they hypothesize, well, it could be that he's gotten in a fight with his best friend, and so he doesn't have any other outlets. But at the same time, we need a roadmap. We need hope. We need to know what to do. And I'm trying to hold for them. How do we hold hope in this circumstance? And I guess where we left things was really trying to highlight, because dad is pulled in all the directions. He's trying to figure out, how do I manage my adult son, who's still a child? How do I maintain this newish relationship? And how do I connect with my stepson, who actually I would like to spend time with, but there's really not a lot of breathing space. And so he is doing an incredible job, but he is so overwhelmed. And so where I left things last week was just like, we need to figure out how to give you some space and where the boundaries are. And if, they have OPWDD and money for respite, so how can you take more regular respite? Because it just feels so toxic so much of the time. So I'll just share I'll just share yesterday's session briefly and stop to breathe. But so when college brother Jonah came in, very angry, and
Was there
Asher.
all 5 of them there yesterday then?
Yeah.
Usually 4 of them. But
Yeah.
Okay, got it.
And Asher said, I'm really not looking forward to this. I'm going to just be attacked the whole time. So I said, okay, let's figure out, what do we need to make this a different experience? Because I really don't want him to be attacked the whole time. And I think I had let that happen a little bit too much the first time around. But so we did a lot of talking about using I statements, which, we had brought up much earlier on, and I had been totally shut down by Asher, and many times sort of felt very helpless and hopeless when he would just like just shut down any attempt that I would make to try to have a different experience. But actually they were all more receptive, and they were talking about it. And Dad was, I started, I guess I would say, with, it's like, okay, we need to make this a little bit different today. So let's go around and say something positive if you can about the family, or just something individual. And everyone did. And there were a few positive family interactions, but the way Dad says it is like it's a drop in the bucket in a sea of just crisis all the time. But he felt a little bit like he had been intervening between the brothers successfully and able to stop things from being like just so toxic all the time. On the other hand, the dynamic is when the brothers are home, everybody else gets a little bit of a break from Asher because they don't have to bear the brunt of Asher's intrusiveness. So,
Is there
so
another parent of Asher? Does he go to another mom's house or anything, or no?
in the past, she's been more involved,
Okay.
but it's not as active, and they have a pretty strained relationship, and I guess some toxicity there. So Dad is the primary
Got it.
caregiver. Yeah. Um, Anyway, I guess the interesting thing is during the session, I felt like Asher was doing an amazing job. And I was trying to highlight for him and for everybody every time he was actually able to validate. And we talked very specifically, because Brother's just throwing all these attacks out. But we tried to focus on something specific. And so he said, well, here's an example. Yesterday I'm driving Asher and I don't really want to, but I'm doing it to help my dad out. And I'm driving him and I'm playing this music and he says, who is this artist? And I say, actually, it's my friend from college. And Asher says, oh, no wonder it sucks. And for Jonah, this is really rude. So we talk about like, why is that hurtful to Jonah? And Asher was actually able to hear like the feedback that maybe there are ways he can still be his authentic self with his taste without being so hurtful. He was able to accept it. And so there was some positive things happening in the room. And then at the very end, we were talking about respect as a theme. And I invited the parents to share like, what does respect mean for them? When it got to Dad, and Dad does an amazing job. He tried to be balanced and even and said, okay, because then we were ending it with what's one change that could help each person feel more respected. And so Dad was saying, you know what, Jonah, I don't think it's unreasonable for you to give this attention to your brother when he's asking for it in this small way, because clearly, you guys are talking about the negative attribution bias, definitely there. Jonah's just like pent up anger and rage and all this stuff that is so out of proportion to what's actually happening. And then Dad turned and tried to give feedback to Asher to say, I know you're working on it, but it's a really small house and you're really loud and we don't have a lot of breathing space. And then he actually used the word like intrusive. And at the very end, Asher just lost it and, screamed and flung out insults at everybody. And then it just erupted into laughter because they were like, see, this is where we're at. And, I think Asher was left both angry, but also confused. Like, I mean, he could laugh at himself a little bit, but he still didn't really, he just felt attacked at the very end of it. And so we just like left with it's hard to be respectful when you feel attacked, but for him, he feels attacked when anyone gives him any feedback at all. And so it makes it very hard to see even incremental change.
And they are all mad at him.
Yeah.
Right. There's a lot of pressure. Nayla, you are like amazing. I give you so much credit because what you're trying to hold in one room with where they are is unbelievable affective load.
Yeah.
Mm.
Yeah.
I mean, that is unbelievable to think about going through all these sessions with all of them together with this many layers at this intensity. It's incredible.
Yeah, it's exhausting when you
But
have that many people
yeah.
in the room just to even keep track of what's going on and not let everything get out of control.
But I think that may be the most important question is kind of where things are and who should be in the room when and how to talk to them about it.
Yeah.
Does that make sense? Because it's almost like there's so much pressure to release.
Yeah.
And if you think about even the example of the college brothers pressure, like that's been his life.
Yeah.
Probably
Yeah.
never processed it. He's
Yeah.
probably often been neglected himself.
Definitely.
Expected to step up. And
Mm.
without allowing him to feel supported and the parents to process that with him, I would find it impossible to see how we could put them together.
Yeah.
Does that make sense? I mean, there's no one right way to do it, but I look at it
Mhm.
as you need to get the pressure out in
Yeah.
order to then focus on like maybe a dyad or what message the parents together are giving.
Yeah.
Right. Right.
We're like, would you ever meet with the siblings alone?
Well, brother's not here consistently, but I definitely, and I highlighted yesterday, just like how brother really does need his own space to process, because this is so clearly, and Asher can see it too. And Asher says, you're mad about things that happened years ago. I'm not the same person as I was. And I don't know how to tell you that. And so it's true, it's his own trauma and his own, he's, when I tried to ask him, does he have supports? And I meant like therapists, he just said, I'm so depressed right now that actually I don't think anyone wants to be with me. And so he's just sort of also projecting um, all this anger that's directed at Asher, but it's also at himself.
And,
So
and that gets to such an important layer, I think, because even if we just zero in on him at the age he's at, what has probably happened to him is he's been repeatedly demoralized. He tried to move out. He tried a job. Failure, failure, failure. His brother's going to college, right?
yeah,
He has a different skill set. He's still
yeah,
struggling with basic emotional regulation, but he's feeling so bad about himself.
yeah,
And it's
yeah.
probably hard for him to talk about. So
And wait, Asher's the one who's depressed?
yeah, he's
Well, actually,
overloaded for
so
there.
depressed. I meant the brother, and I think you
Which
switched
brother?
Asher. I meant
Jonah?
Jonah. Sorry,
I,
was
well,
the
no, I hear that, but I was talking about even just with Asher,
yeah, yeah,
right? That
Asher.
unless that can get released, and I know he's in therapy too, but if that
Correct.
can get released, then maybe they can process it differently. Because part of the work is around he and parents really working on what is his arc.
What's
What
his arc?
what
I
would
don't.
success be for him?
Yeah,
Does
and I
it
wish.
suck that he doesn't get to have an easy social network? Yes.
Yes, definitely. And I wish I had more experience so I could help them with the arc more confidently. Are
Oh,
you
you
guys
know how to do that.
okay?
You do, because it's just thinking about it like we do with every kid, not just on the spectrum, right?
Yeah,
But it's like there's many paths into adulthood.
yeah,
And we have to, and here's part of the frame that I think is so important. What helps people the most going into adulthood is when they have self-awareness and other awareness. Does that make sense? Some
hmm
people naturally have a lot of both. Some people don't have any. Things like autism spectrum disorder make that harder
yeah,
than
yeah,
it otherwise would be. But no matter what his path is, that's the work.
yeah,
Parents understanding that he needs help with that, right?
yeah,
Because
yeah.
they sound pretty self-aware, thankfully.
They do. I think the stepmother a little bit less so, but she's trying to understand and yeah, interestingly, Dad said when we were talking about respect, he feels a little over respected by his wife. So there is a way that she holds him on a pedestal, and he really is like holding it all together for everybody.
Mm.
Yeah, but yeah, very helpful, and thank you. So I do wonder, in terms of the pressure release, I've been wondering actually. Yeah, I do wonder what the dyads are that could be helpful to meet with. I had for a while been trying to, and I don't know, I think bridge was the word I was thinking, if I'm using it correctly, but even just, the experience of Platon, who had been like silent and withdrawn, with Asher, because they both are, stepbrothers, in this new blended family, and that they have very different communication styles, but they both sort of feel abandoned by their parent and things like that. And but whereas Asher desperately wants to be friends, Platon again sort of says, if I was 18, I'd be out of the family now, because this is um,
And
not yeah.
and what you just shared even about Platon, like this brings up such fascinating questions, right? Because it's like you're in this role of family therapist, but in order to do that job, what individual conversations do you need to have at certain junctures to
Yeah.
be able to do it? When does someone need a referral for more?
Yeah.
How do you draw those lines? Like I don't have the answers, but that's what you're getting at, which is fascinating to think about.
Yeah, Platon has his own individual person.
Oh, okay, great.
I don't know that Jonah does, and he certainly needs it. But yeah, I guess I do wonder, one thing I was wondering about as we were talking about the bridging across sessions and how mad Asher is that he'd been left out from the parent conversation. And the parent conversation was about, how do we help give space? But honestly, what does respite look like? Are group
Did he
homes?
know about that conversation ahead, that it was gonna happen, or no? Or did it come up as an emergency request?
I think it was not planned by me, but the
Got
parent,
it. Got it.
Natalia requested it after a specific blowout, and where she's sort of saying, I can't do this anymore. I need some extra support. Yeah.
So he didn't expect it, right? Which sometimes this happens. But I think it gets to one thing that, again, there's not one right way to do, but how we even frame it up front with what doing family therapy is. Like, I've learned to say, I didn't always do this. I've learned to say in the beginning, doing family therapy doesn't always mean everyone's going to be in the room together. And
Yeah.
it may even mean sometimes I may suggest even myself meeting individually with someone as
Mm.
part of moving everything ahead, even if they have their own therapist.
Mm.
Like, I would not be able to do this work as the family therapist with any of these kids without having a little individual time with each of them.
Interesting.
Because you don't get the whole picture. And then
Right.
meanwhile, it's like you're walking on a minefield, you don't know where the bombs are.
Yeah.
That makes sense. And again, I haven't always done that, but I'm thinking about a case I won't get into details, where the original call was about high sibling conflict between two young adult brothers, both with autism, both sort of different versions, both very impaired, one extremely violent, right? They both had their own treaters, their own psychiatrists, whatever. And when I first talked to the parents, they were like, "Oh, can you meet with the boys and work it out?" And I said, I need to start with talking individually to everybody, talking to
Mm.
every therapist. And in that case, ultimately, it was only safe to get to a place of having one conversation between the boys, which I kind of knew wasn't going to work because
Mm.
one was so ill and impaired and dysregulated that he couldn't participate.
Yeah.
And so part of my work with that family was helping the parents work towards getting more supports to stabilize him, because
Yeah.
doing family therapy in the sense we all think about it doesn't always apply
Yeah.
if people aren't able to do it. I'm not saying that's the case here, but I'm saying I would not be able to do family work with even the main identified patient and his family about his independence without at
Mm.
least having a sideline conversation with him.
Interesting. Yeah, I hadn't thought
But
about that.
that's just my attitude. Other people may look at it differently. It's not, I'm not saying that's the only way to go.
That sounds great to me. I think I agree 100%. I do also wonder, to what extent do Asher's brother understand the nature of Asher's impairment? So that in some families, sometimes they're able to say, oh yeah, that's Jared.
Mhm.
And not take it personally, and so not escalate. And also, how do you teach respect in a context where that may not be a construct that Asher, for example, could hold? He may
Well,
not have that.
Asher sort of said, I have autism. I'm not interested in learning respect. However, and so we agreed upon, though, that he could learn how to be nicer with his words. And he would like to, because actually he loves his brother and he wants his brother to want to spend time with him. And he could say that. But you're right. I mean, Asher is incredibly likable, but argumentative and but he also throws his diagnosis at you to say, that's my autism, deal with it. And he's an asshole about it too. So it's hard. It's hard. So how do you find understanding and at the same time,
Right.
If
That's
the
right.
whole
Just
family
the
thinks,
behavior. Go ahead.
I was gonna say, if the whole family thinks that everyone's like yelling, or that Asher especially is yelling and just talking very, very loudly all the time, has gotten his hearing checked and just made sure that or maybe his ears are plugged with wax or something. I mean, it's surprising what people will let go and don't get checked out by their doctor. But also, they could get a decibel meter to have at home. And then, you can, like, if they're having a tense discussion, they can like have it there between them. Like, they can see if it goes above a certain level. And that might be something that Ash, it's objective data, and I don't know if his autism is, impressed by objective data, but some autistic people are, especially, and that might help him
just
during
like
their
understand
discussions
it.
at home.
And the frame that kind of is getting at, and all of these can be put into, is the balance of everybody's needs,
Yeah,
right? This family has been so subsumed by Asher's needs because they're so dominant
yeah,
that it's been hard for anyone else to feel like they can have needs or have them met.
Yeah.
And for Asher, as he becomes an adult, he needs to learn about that concept,
yeah,
that
Yeah.
there's an I and there's a we.
yeah,
Even if he's going to date somebody or have a friend, right? And so I think there's a way to talk about with everybody and normalize again this pressure that because of so many different reasons, they haven't been able to all have needs.
yeah, yeah.
And never mind the couple, right? Yeah.
Are Platon and Jonah aligned at all?
Interestingly, we've talked about this a lot because Asher has said, why didn't you make friends with Jonah when he was here? Because Jonah's much more normal, although he doesn't seem like it now, but much more neurotypical. But Platon, I think, partly because of his depression, and probably the dynamics in the home, he just has withdrawn. So he never really became friends with Jonah. And most of his alliance is just with his mom. Although he has expressed wonderfully that he wants to spend time with dad. And he was angry when, for example, they planned to cook a meal together and Asher interrupted it, as he does, right? And
Balance of needs. Yeah.
balance of needs. Jonah cannot, not Jonah, sorry, Platon has said, right? Like, what is the point of me like being vulnerable or asking for something when I know you can't do it? You just can't, because Asher takes all the oxygen in the room.
Here's a really important thing I do with that frame of need balance.
Yeah.
Is I help people to be able to even stop and think about what those different needs are. You can take any example, right? In
Yeah.
this same moment, Asher needed this, Jonah needed this, the family as a whole needed this. Part of why that's important is at least getting it all out there. Often that's all incompatible.
Yeah.
That's where tension comes from, right? But sometimes part of the problem is people aren't even able to voice their needs.
Yeah.
Sometimes maybe people could meet their needs and rebalance in the moment if people spoke up. Sometimes not, and then it's hard, and then you still have to give a message about it. But I think it's very different when parents will say to kids, I understand you really need this right now. I understand, right? It's so important to you to spend time with your friends tonight, but we really need you to go to Aunt Susie's wake for the family. Do you see, like, whatever it is,
Yeah.
the way people communicate about it matters.
Yeah,
Understanding it, being aware of it, and communicating.
and validating that it's a reasonable need, even though it doesn't fit everybody else's.
And I'm sorry we can't do this for you right now, but
I'm so hopeful that they actually could validate each other. Asher could validate. And I was like, oh my goodness, because I try to give him that feedback too, or try to punctuate it, because I think in the end, we all felt a little demoralized that in spite of this progress, it's so easy to flip back into anger attack and rage mode, that switch can get turned on. But anyway, I think that, yeah, that's really helpful to think through. We were talking a little bit about dilution. I forget. Oh, just how helpful it is. I think this was getting at the balance of needs without stating it in that beautiful way, but just, people having friendships outside of the family, people having, space where they can maybe have needs met if it can't all happen in one place too, because it's just so explosive. And
Sorry to jump in. I'm
yeah,
curious, actually, just about even just if Asher has this view of himself, but really, does the family see any positive qualities in Asher? It
Yeah.
sounds like, okay.
but it's hard to hold
Yeah.
that. I mean, he's funny sometimes if his humor isn't too insulting. He can be clever, but yeah, I think it's hard to hold the positive. Dad is the best at doing it, and Dad will say and will defend Asher, especially yesterday when Jonah was attacking him and saying, Asher, I love that you're different. You know, it's okay to be different. You don't have to see things the same way we do. In fact, it's helpful for us that you see things different. So that part is, which is wonderful. But I think everyone else just feels like Asher's, because their balance of needs are so off, it's hard not to just be resentful towards him, you know?
And the
I
other thing
wonder-
which, oh, go ahead, Betsy.
Oh, I
Oh,
was gonna
Diane,
say, I
sorry.
wonder about the message, you know, what are the messages that the family members are interpreting, or the, you know, the attributions that they're giving to their people. But, you know, you say attributions to the patients, they don't get it, but they understand what the message is, you know? And so asking someone, you know, what message was Asher sending when he crashed the cooking evening with Platon, you know? Maybe he wanted to be included. Maybe he was jealous. Maybe he was just angry and there was no reason, you know, but like figuring out what that message is. And also, like, did anyone actually communicate to Asher, like, we are going to try to cook dinner with Platon because he's very depressed and we're trying to help him. And, you know, you could be there if you wanted to be, but you'd have to understand that we're focusing on him because we're trying to help him with his depression, you know. But if nobody said anything to Asher, he's not going to understand the social signals to figure that out.
Yeah, such a good point.
And,
Absolutely.
like, how explicit are they with
And
Asher?
remember the why. Explaining the why is really important for people.
And
Yeah,
building
they
on,
disagree.
building on that, I wonder if the rage comes when Asher is feeling sad or rejected or abandoned, and whether that could possibly be brought forward. Like he could even say angrily, "I'm really sad. God damn it."
Yeah, and he can. I just worry because we have spent a lot of the session. We had come back from ACAP when we started, like turning towards the rage and diffusing, and it works to some extent. But it also, I think everyone in the family sort of feels like, well, here we go again. This is Asher's session because Asher has so much. It's hard. It's a hard balance. Do you know what I mean? Because we could spend the whole session on Asher's. Abandonment and rejection fears and anxiety. And so I've been trying to balance that with also, and I think Asher is happy to say, I don't want this family therapy to be only about me. So he gets very happy when we put Platon on the hot seat and move the attention around a little bit.
Are you his prescriber as well, or somebody else? His
therapist is actually his prescriber.
So
Yeah.
that was the one other quick comment I want to make. I know we have to wrap up in a minute, but it's so important in these cases that with the young adults, it can get very complicated. Sometimes they don't want their parents involved in decisions. Sometimes they do. But
Yeah.
either way, if we don't coordinate, it's going to be hard. Because I think one thing we've all sort of touched on is probably at least part of his irritability being so extreme right now is maybe related to him getting more depressed the last few years. Right? Like, we don't know all the answers. We have to put all that together. But sometimes I've been in the case of doing the family work that the input I have based on interactions about how a patient's functioning can help with med choices.
Absolutely.
And vice versa, because we don't want to miss like something
No,
that's out of his control to change. That makes sense?
Definitely. He actually had a med change recently. So I tried to give the feedback.
Yeah.
Well, back, although I don't know if the med change was helpful or not. It seems like maybe not, but they think maybe. Anyway, yeah, so important to do the feedback loops.
It
Absolutely.
gets to what Diane is saying, and that is, what are all the reasons why he has these outbursts?
Yeah.
Thing.
Yeah.
I'm kind of curious, what does the family do with, when he says he has autism? Because it sounds like he kind of has a view, well, I have autism and this is me, and I can't change this. It's not, do they even see that this is something that he can change? Or is this all like, oh, okay, he has autism? And
Well, I think they feel like he's using it as a weapon.
yeah.
No.
I like the frame with the self-awareness, other awareness, which is, again, I think something for everybody growing up, But with people on the spectrum, what I've often said is I want to help you come up with your own like manual for your brain. Like
Mhm.
what works for you. Certain things may be harder for you than other people, like reading somebody else's emotions. So I want to help you hack your brain and understand what works. Because I know
Yeah.
you want to have relationships,
Right.
whatever. Does that make sense? But everyone looking on it that way can be helpful. And that gets into the whole what is success conversation.
Yeah. Yeah. Such great
Right.
points.
Does he fight that thought that they're like, that he could change, or, he just come back with like, well, I've got autism and this is, I'm
Well,
never going to be able to gain that skill.
no, I think he does think he's made progress. And
Oh.
I don't know though if he views he's made more progress than he has, but at the same time, like he has made progress but it's hard because he's just very quick to kind of going to the all or nothing statements of, well, like, I don't really care to change that. It doesn't matter to me. And like
Mm.
shutting down what someone else's need is or ask is. Although he was able to hear the feedback yesterday when we just sort of said, okay, but we're working on, you do care about your brother, you do care about your mom, they care about you, we're all here. So can we like try to listen differently or give and he could, which was great, but it's hard. Yeah.
It may help
And
him in some conversations, whether individual or family, to quantify in these scenarios, how much does he perceive he has control or not?
yeah,
Because that's where then you can set the frame for, okay, well, let's work on what are strategies that may help you feel a little more in control. What's
yeah.
a med change that may feel like you have a little more control,
Mm,
Mm.
right? Because it's not like all or nothing.
right.
And it sounds like it really probably is worse now than it used to be, which there's probably good reasons for.
Mm.
I wonder at
Amazing
the,
work. Amazing work.
Thanks.
if you probably did this in like early sessions, but have you gone through basic communication skills with them? Like, this is
Well,
how you listen, this is how you say, this is what I heard before you respond, that kind of thing.
I tried to early on and got totally shut down, but I have some hope that they've come back to it, they're open to it now.
Oh, good. Yes, because I
I
feel
think
like that would help too. And with a lot of people raise their voice because they feel like the person didn't understand what they said the first time. And, if he's just getting louder and louder because he feels misunderstood, and
Mhm.
they could give him some verbal feedback about, okay, we heard you. And, then maybe he wouldn't yell as much.
Mm,
And then also sometimes the person who is yelling, if you just tell them like, if you're too loud, I actually can't hear you because you're so loud. It's like a jet engine. It's like, it's so loud, I can't understand the words.
mm,
And sometimes they're motivated to not be so loud that the person they're trying to talk to can't even understand what the words are because it's so loud.
I have a feeling, Nayla, it would go over very well with all of them at this point at the next joint meeting. If you put some thought ahead into maybe some of the separate conversations you want to have, right? Now
yeah.
that you really know them and you're trying to work on multiple things, I have a feeling they'd probably hear that pretty well.
You mean the request to meet separately?
Yeah, whatever you think you may want to do, and you
Yeah.
don't have to all at once, but even Asher, I think if he
Mhm.
understood, and if you were going to do that, my tendency would probably pick to do an individual meeting with him first. To lay
Interesting.
out with everybody, like
Mm.
here's what I think might be helpful. I think it might be
Yeah.
helpful for me to hear a little bit more from Asher, right?
Mm,
For me to meet with parents, whatever you want to do.
yeah.
You have to explain the why and then get their feedback on maybe what order to go in.
Interesting.
I
Yeah,
would
yeah.
tend to suggest Asher first for a variety of reasons, but
I think so. And then maybe Asher and Dad.
it's interesting that what people have to say when we give that kind of
Hmm.
feedback. Usually they're very accepting and find it like helpful.
Yeah, I think Asher really would want it because many times I know we have to end. He would ask for my feedback. He wanted my feedback. What are you
Yeah.
seeing? What can I do differently? At least at the beginning, he was very
And you could say, sometimes I feel like there's so much you all want to talk about. I don't get to hear everybody out.
yeah.
And I want to make sure I'm really understanding everyone's perspective as we go to the next level.
Mm, that's a great idea. Thank you guys.
The next level is also hope.
Of
Yeah.
course. Yeah, of course.
Mhm.
Yeah.
Yeah.
Mhm.
But amazing work, Nayla. Both of you guys, really incredible
Thank you.
what you're doing in these very intense situations in limited time and right? Incredible.
Mhm.
Thanks.
Keep it up. The world needs this right now.
Right. Well, I really appreciate everybody's insight and just even, Nayla, you sharing your case. I mean, it's just fascinating just to listen to how you're managing this, and everybody, I just learned from that too. This is really great for me, so really appreciate everybody coming and allowing this to happen, I guess.
Don't you wish at least one thing in life were simple? Nothing is simple. I particularly always think that way on Friday afternoons myself.
Well, my daughter would say if I just did certain things, it would be simple. So maybe I need to listen.
All right, you guys, great to see everybody.
Thank you.
Take care.
Bye.
Bye. Thanks.